coronavirus questions. We start with the topic of reopening, which is on so many of our minds. So when will Oregon's most populated counties reopen? Pat Doris has the update.
Here's where the counties are at in phase one. Clackamas County applied yesterday. Washington County is going to apply on Friday. Multnomah County, well, Multnomah County doesn't really want to be tied down there. Just not that sure when they're going to apply. None of the counties have all of the contact tracers in place that they need, but one of the counties is telling me they're being assured by the state you don't have to have them all in place as long as you keep hiring them and put the team together as fast as possible. So in the greater metro area, it looks like 2 out of the 3 counties will apply and be moving into phase one rather quickly. Multnomah County, the most populous county, not so much.
And we know many of you have also been wondering about Marion and Polk counties. They were initially denied to start reopening, but we've learned the governor just approved both counties to move to phase one. Starting on Friday, certain businesses can reopen. We're talking about restaurants and bars, salons, gyms, and malls, but they're going to need to limit crowd sizes. They'll also have to have physical distancing restrictions and require face masks. As for counties in Washington, well, Clark County is now eligible to apply for phase 2 of the state's reopening plan. Governor Jay Inslee gave the green light because Clark County has had a low infection rate over a 2-week period. If Clark County gets approved for phase 2, things like hair and nail salons as well as barbershops will be allowed to reopen. Restaurants can also open their dining rooms, but only to half capacity. There will also be more outdoor options like camping. In southern Washington, Skamania and Wahkiakum counties have already moved into phase 2. One of the big barriers to reopening is contact tracing. And joining us tonight is Dr. Claire Wheeler, a public health specialist with PSU and OHSU. And Dr. Wheeler, we want to start off with this notion of contact tracing. Could you please first remind us what contact tracing is, and also if you could just give us an overall update on Oregon's testing capacity?
Sure. Yes, thank you. So Oregon's testing capacity is actually greater than the testing we're doing. There's a minimum of 30 people per 10,000 people in an area per week who need to be tested in order for a county to start to open up. And most of the counties have accomplished that. In fact, they've exceeded that, but people are not going to get tested, so their capacity actually isn't being met. So I think that over time, as more and more people become aware and interested in getting tested, that we'll start to meet that capacity. But we're looking really good in most counties with respect to testing. And as we just saw, there is a little bit of a lag, however, when it comes to contact tracing.
Okay, and remind us again, contact tracing, in simplest terms, to remind people what that is.
Yeah, so with contact tracing, if someone goes and gets a test and tests positive, whether they're symptomatic or not, what you would do is obviously you're going to treat that person or ask them to isolate themselves at home if that's safe to do so. And then the contact tracer, by the way, OHSU is hiring and training people to be contact tracers in Oregon. So if you're looking for work, that's a good place to go. We need lots and lots of them. So what they would do is interview the person who is tested positive and say, where have you been? Who have you been with over the last few days? To the extent that that person can remember everyone that they've been in contact with. And then literally that person, the contact tracer, will get on the phone with each person who's come into contact with the one who's been identified as a case, and that person would be asked to isolate themselves for a couple weeks and get tested. And in that way, we can, maybe that original person could spread the virus to a few people, but with contact tracing, we can find those people really quickly, get them taken care of, get them tested, and get them at home for a couple weeks, and so that they aren't able to spread the virus to anyone else.
Absolutely. I know our largest, most populous counties need to shore up on that before moving forward. And yes, our next question comes from viewer Gordon. He asks, does an N95 mask protect the wearer or other people?
Yeah, and this is such an important question. because N95 really is just a term that describes the maximum size of something that can move through the mask, the material that the mask is made of. So N95 is really referring to a material and not a specific mask per se. So this mask here, and I hope you can see it, this is an N95 mask, and you see this yellow button here. That's a valve, and that's actually a one-way valve. And what that means is it will protect the person wearing it because it'll filter the air the person is inhaling, but it just lets everything in their breath come out through this little yellow hole here, this little yellow valve. So if you see someone, if you're out, you're venturing out into the world and you're wearing your mask and you see someone wearing one of those, you are not safe from that person. They can easily be exhaling virus into the air even though they are protected. Now, there are many other types of masks that are made with N95 material. The ones you see, they're kind of turquoise and bowl-shaped. Those don't have the valve. And so if you see that, or if you're offered one of those, that's okay because it's going to protect you and the environment around you.
Wow. Okay. Very good distinction, I think. And our next one is from viewer Kathy. And Kathy asks, are there any long-term effects of COVID-19? For example, do people have, say, breathing problems even after their recovery?
Yes, the answer is yes. And the long term, that's a relative term because we've only been dealing with this for maybe 3 months or so. And so we aren't really in the long term yet. But what we're seeing in people who have been hospitalized and released or who have had a bad case of this at home is continued weeks and weeks in many cases of fatigue at the very least. Definitely trouble breathing that could be associated with permanent damage to the lungs. This virus seems to be very harmful to the kidneys. So a lot of people have to be on dialysis while they're sick and sometimes even after they're all better. And then there are just these mysterious rashes and muscle pains and blood clots that a lot of patients are being discharged now on blood thinners because blood clotting continues to be a problem even after a person's well. And then, of course, we also have to think about the depression and the anxiety and the trauma of having been intubated or in the ICU or in the hospital. And I think this is where we need to start maybe shifting some of our attention in public health and in healthcare, start to address the psychological and emotional impact of what we're all going through right now. I think we really need to start looking at that. And finally, now we have this mysterious, it's called the pediatric multisystem inflammatory syndrome that is affecting children across the country. And now we have over 100 cases in 14 different states in the U.S. And that seems to be in the aftermath of an active infection as well. So that's somewhat concerning. It's still very rare, but it is something that's happening. So this is going to take a while for us to really figure out what are the long-term outcomes after this infection. But as we know right now, it's not just over when it's over for a lot of people.
Yeah, so many different types of complications. Thank you so much for breaking it down, and thank you for being here with us this evening, Dr. Wheeler. Really appreciate your time.
My pleasure. Thank you.
Absolutely. And you know what? At any time, you can send us your questions. There is a new number that you can text. It's right there on your screen, 503-226-5088. If we don't get to your question tonight, we will be answering questions right here at 7 o'clock Monday through Wednesday. Are you planning to visit your dentist or maybe doctor soon? If so, how can you stay safe? When we come back, a few things you may want to consider before your checkup. But first, a question. If a worker at a food processing facility tests positive for COVID-19, is the facility required to recall food? Well, the answer is no. There is currently no evidence to suggest that the coronavirus can be transmitted through food.
As more and more states open up and businesses do the same, there's one stumbling block being reported: public restrooms. Let's connect the dots. As the public gets out and about more, it's just a fact of life that people need to use restrooms. But most people report not feeling comfortable using them yet. And this means businesses are having to adjust, not just the fixtures in their bathrooms, but also the employees they hire. According to the Washington Post, restaurants are now looking for more than just chefs and waiters, also bathroom monitors. The job involves not just keeping the space clean, but also ensuring customers wait their turn at a safe distance. McDonald's is now requiring franchisees to clean their bathrooms every 30 minutes, and that appears to be a common trend in the restaurant business these days. The people who make bathroom fixtures have seen a surge of requests not just from restaurants, but other businesses as well. There's a huge demand for touchless features in copper, which has antimicrobial properties. Those high-powered hand dryers are falling out of favor, though, thanks to concerns about blowing germs around. And experts say these changes are probably not temporary, as concerns over cleanliness in public restrooms was a thing even before the pandemic. Connecting the dots, I'm Stephanie Whitfield.
With dental offices and other healthcare services back open in Oregon and Washington, is it safe to visit your doctor again for non-coronavirus checkups? Here's NBC News' chief medical correspondent, Dr. John Torres.
Going back to your doctor and how to stay safe. All 50 states are now partially reopened, and in many, that means dentists and doctors' offices are open for business and starting to see patients again. But up to 80% of people are skipping routine appointments, according to the American Academy of Pediatrics. But you don't want to let the pandemic get in the way of your health care. Dental cleanings, physicals, checkups, it's a good time to resume those regular visits because it's better for your doctor to see you in person than over a screen. But before you go, ask them, how are you going to keep me safe? Talk to your doctor's office to find out how they handle appointments. Do you wait in the car until the doctor is ready to see you? Are you in a waiting room, socially distanced from others? Or are appointments staggered to minimize contact with other patients? And if they've had any patients or staff with the virus, what did they do about that? Remember, you should take the same precautions you would going into any business. And if you are a parent, it's especially important to make sure your child is getting their checkups and up to date on their vaccinations.
All good advice. And, you know, we've heard a lot lately about researchers looking into COVID-19 antibodies, but how can that research help in developing a vaccine? NBC News medical contributor Dr. Nahid Badilia explains the results of 2 new studies.
There's actually 2 studies, as you said, from Beth Deaconess that basically looked at monkeys that were infected and recovered and then were re-exposed to the virus, and the antibodies that they created after the recovery from the first infection protected them against the second. The second study that they did was they gave them a vaccine and produced the same kind of antibodies and proved that those antibodies seemed to be also protected for a new infection if they were exposed to it. So they did 2 things. One, they showed that these antibodies can be protective, and 2, that the vaccine could potentially give you that same level of antibodies that could be protective. The only thing, unfortunately, that we don't yet know is how long does that immunity last? So that's one important part. And the other is, can we translate this data to humans? And I think most people think that we can, because these are models of animals that we generally use for other studies as well.
Yeah, so much more to learn. Coming up, scammers are filing unemployment claims in other people's names. So what can you do to keep yourself safe? But first, a question. If you use public transportation, what precautions should you take? The answer, TriMet is now requiring riders to wear a face covering on buses and MAX trains. If you don't have one, TriMet will have them available.
Home Place Furniture.
Our next question, how can you help protect yourself against unemployment fraud? Well, scammers are filing claims in other people's names to try to get money. Experts say it's a good idea, especially now, to take a proactive approach to handling your finances.
It's so unfortunate, but it's not that surprising because scammers take advantage of any opportunity that they can. Now is a good time to be monitoring your credit, checking your bank account, making sure there's no suspicious activity and no fraudulent activity.
And are you thinking about a career change maybe? Well, some people are seeing this time as an opportunity. Vanessa Mishanya from our sister station in Seattle spoke to a career coach for some advice.
The pandemic has many of us finding ourselves right here at a crossroad, forced into a new direction. So what do you do about that? Well, I asked an expert and they told me, embrace it.
In your 10 years, have you ever seen a time quite as unique as this?
No, I think this is a first for all of us.
Xian Qian is a career coach. She is seeing a lot of folks right now wanting a change, whether they've been laid off or now finally have time to examine their goals.
And I just sort of thought, I don't want to go to work tomorrow. And it really felt deeper than like I need a break. It felt like I don't want to go to work ever again.
Kristen Anthony is one of those people. She had a job, but the pandemic made her examine some deeper questions.
This is making me think about my own death, and so what can I change so that I would, feel better, feel proud, feel like I had an impact if I were to go tomorrow.
The employment numbers right now, yes, they may seem bleak, but Sheann says the jobs are out there. Her clients are getting opportunities in fields like tech, creative, PR, and healthcare. The key is using your downtime to really think about your goals, be intentional in your search, and prioritize your needs.
And when you are coming across a roadblock like the pandemic that's forcing you to take a new direction, that could be really scary.
It can. It might be something you've never done, that you're not used to having to make your own decisions intentionally and thoughtfully outside of your career track. And so it's really shaking up a lot of folks.
So it's a good time to really be intentional and make choices about where you want to be when we emerge from this.
Wow, so interesting. Still to come during the pandemic, what does the adoption process look like? We're going to walk you through the changes after the break. With so much uncertainty because of the COVID-19 crisis, are you feeling anxious or depressed? Maybe you're worried about a friend or a family member. Well, tomorrow at noon, we're getting some guidance from the experts. Our Cassidy Quinn will moderate the conversation and she'll take your questions. You can find the show at kgw.com or on any of our social media pages. Despite the pandemic, adoptions and foster placements are still happening. So what is the adoption process like these days? For the answer, we spoke to the president and CEO of the Dave Thomas Foundation for Adoption.
We're certainly seeing them delayed, and not every court is able to or wants to pivot to technology in order to finalize adoption. So we're encouraging through our programs to utilize the platforms we have, to utilize Zoom, to utilize Microsoft Teams, whatever they have, because once we've gotten to that adoption finalization, all of the work is done.
We hope you found our evening show, our question answer show, beneficial, especially with the talk back with the doctor earlier on. And we thank you for joining us tonight. And you know what? If you still have questions, some of our past stories may help you find the answer. You can go to kgw.com/answers to see all of our past Q&As. Have a good night.